All right, hello everyone. Thank you for joining me for another YouTube live. Now we're just on YouTube. We're not doing these on other platforms now. I think it just gets a bit weird because it's easier for people to ask questions directly on YouTube. Things like Instagram, it doesn't it doesn't show up the questions here on StreamYard, and so I have to sort of go over there and try to find them. It's just just a bit weird. So we're just doing these here, just so people know we won't be doing these on like a joint platform anymore. I might do lives on other ones, but those would be done by themselves. It's just when I'm doing YouTube lives, I'm just going to keep it to YouTube for now anyway. Okay, so thank you all for coming on. I just wanted to start with some of the questions that popped up here before we started here. One is from Tim Smith, who says, "Hi, Dr. Chaffee, 42-year-old male, 18 months, carnivore. I got a PET scan recently, and they found a 2-centimeter nodule on my thyroid. They want to aspirate it for testing. Is there any danger in aspiration?" Yeah, there's dangers in any medical procedure. Obviously, this is something that your doctors and surgeons will be able to tell you about, and the different sort of risks, very low risk of infections, things like that. But one of the concerns that people have is that when you're doing any sort of needle biopsy or aspirate or just sticking sharp object into something that could be cancer and pulling it out, you might track and seed those cancer cells along the sort of the exit wound, and now all of a sudden that leaves it open to metastases and things like that. That is a concern too. It's, again, you have to sort of look at how common that is. I don't know the exact numbers. I don't deal with thyroids, thyroid biopsies and things like that. That's just not my field. But that's a fair question to ask. And if you sort of ask them, what are the odds of this actually being cancer versus something benign? What if I just wait and see what happens? What are the risks if I do this, and what are the risks if this does turn out to be cancer? And that does that aspirate or biopsy, is that going to increase the risk of spreading the cancer? And if so, how much? And then you can make an informed decision. So it's all about making informed decisions. You can't make an informed decision if you don't have the information, if you're not informed in the first place. So, do get informed. Ask your doctor these questions. Realistically, they should be telling you this stuff themselves anyway. And many of them do, but sometimes they rattle these things off so quickly that it may just not really register. So, very fair questions to ask your doctor. Yes, there are always risks with any procedure. Sometimes those risks are quite severe. Sometimes they're quite minor, like the risk of infection, extremely minor. But it happens, and if you get that infection, it can be a serious one. So there are these risks, and what you try to do as a clinician, and certainly as a patient, is you try to only do things where the benefits far outweigh the risks. And so, if this is cancer and this is something you catch early, can you treat it more effectively? Yes. If that spreads and you sort of seed this along the sort of the needle injection route, can that cause spread and things like that? Is that going to cause more of an issue down the road? So those are some of the things that you have to think about to be able to make an informed decision. But we do a lot of biopsies on thyroid nodules. Most of them are benign. Thyroid nodules do come up a lot. If it's showing up hot on a PET scan, that's going to maybe change the calculus. Is this more or less likely to be something of concern? And then go from there. But again, you need to sort of talk to the specialist on this and get the exact sort of issues. Or the exact risks and benefits of doing all these things. I mean, I can't give you all of those things because I'm not your doctor and I don't know your full story. I don't know the whole picture. So that's why you can't really give medical advice on the internet. You can only sort of speak in generalities. And so in general, yes, there are always risks of any procedure. And if your doctor's recommending this is something that they have calculated or should have calculated to have the benefits outweigh the risks. but that's their calculus. It may be that when you look at the risks and benefits, you say, oh, actually, to me, the risks outweigh the benefits, not the benefits outweigh the risks, which is what it should be if I misspoke earlier. So talk to your doctor is the long and short of it, and ask those questions. Those are very fair questions to ask, and they should be able to give you, reasonable averages and percentages and likelihood of risk and things like that. Let's see this one thing here. Sorry, I'm just going to, something just popped up. Let me pop this over here. Okay. Oops. Okay. So there's a question here by AD Astra who says, may I ask if there any study or observation of benefits of carnivore on ongoing pericarditis from the pandemic? I'm aware of no studies to do with that. I would doubt that anyone's done one specifically on carnivore. There are people that anecdotally have said that they've had improvement with things, like sort of chronic conditions that they've gotten since that era, whether it's from getting the infection or getting injury from the jab and things like that. That's anecdotal, so we don't really know how many people are going to be affected, or how many people are going to improve. What conditions they're going to improve from? Is it specifically this? 80% of people seem to get better, or something else. It may not be. We just don't know. We don't have those studies. The thing to do is just try and see how you go, and hopefully you get better. It is a very anti-inflammatory diet, a carnivore diet generally. You're removing things that cause more inflammation and damage to your body. Ketones being elevated when you're in ketosis, which you will be, will suppress inflammation even further. And so this is something that can be very helpful. And so in general, it's a very low inflammatory diet, and so that can hopefully improve things, and you're putting your body into a position where it is more likely to heal from whatever you're being faced with, because you're improving your immune system, you're improving your nutrient status. Your body just has the building blocks and materials that it needs to improve and heal itself, which it can do in most circumstances. And you're eliminating out things or just stopping them from coming into your system in the first place that can cause harm and disrupt your body's natural healing and make things worse. So it's definitely worth a try. There are people that have improved anecdotally, but we have no studies that I know of on this. I don't even know if they've done studies on ketogenic diets and recovery from things like pericarditis and things like that. I don't know, not that I know of, but you could just do a PubMed search or a Google Scholar search. Google Scholar usually has a wider net, usually a bit better, and you just put in pericarditis and ketogenic diets, see what pops up. If nothing, then fine. And if something pops up, then great. Have a look at that and see if that's something that how good of a study it is and how robust it was, how many people were in it, and all that sort of stuff. But either way, this is going to help you in so many other ways. You're going to improve your health in a plethora of other ways, and so it may help with pericarditis. It certainly will reduce inflammation, and hopefully it will help with that. And so it's still worth a try. Okay, Melissa was saying that people were asking about sort of where I got this shirt. This is my "No One Likes Brussels Sprouts" shirt. This is on the plant-free tees. So these are the t-shirts that I have. They should actually pop up underneath YouTube, but we've been having problems getting it pop up in most countries. And I've spoken to the YouTube rep about that, and they have no idea what the hell's going wrong with that. But you can just go to plantfreetees.org. It's .org, not .com. We had to change that for some strange reason. It didn't. .com wasn't working for some reason, so we had to change it to .org. So plant-free tees, TEES or TWES .org, and you can take a look at the shirts there. And I have this one and other ones, you know, Body by Beef and all that sort of stuff. I have the Plants Are Trying to Kill You one with like the killer broccoli. It's very cartoony, but that's my favorite. It just cracks me up. You know, might wear it next time or something like that, so you guys can see it if you haven't seen it before. But it's on that main page as you go in. You should see the Plants Are Trying to Kill You. It cracks me up. It's like evil broccoli, you know, going around like ravaging the countryside and things like that. Oh, Jesus Christ. So L did a very generous super chat, which is very sweet of you. You didn't have to do that, sweetie. It says, you're amazing. Your health advice is the best advice I've received from any doctor. Well, thank you very much. I'm glad, and I'm glad you're doing so well. And she has. I mean, she's been doing amazingly well. And, you know, just the health of us and her and the kids have just get better every year. So thank you, sweetie. It's very nice to see you. Okay. So super chat from Christian. Thank you very much, Christian, for the super chat. Hey, Anthony, what is your personal experience with muscle growth, and what training style, weight reps, fast frequency, or rest and frequency has worked best for you? So being carnivore, I've never been able to put on muscle more easily than on a carnivore diet. And this is actually very similar to what the golden era bodybuilders like Vince Gironda, Serge Nubret, and even Arnold Schwarzenegger would do. They're basically just meat and eggs, steak and eggs, steak and eggs, steak and eggs, steak and eggs. So I talk about very high protein, but they actually had decent amount of fat in there as well. And so that's important. And they stayed lean, you know, most of the year, especially prior to Arnold. Now, Arnold wasn't as jacked as he was full-time, full year, but Serge Nubret pretty much was. And he was, you know, he's sort of 10 years older than Arnold, but arguably a better physique than Arnold had, and in direct competition. And there was in that movie Pumping Iron with Arnold Schwarzenegger, where, you know, one of the ones he won the Olympia. He was there was Serge Nubret, and they really they really put it about like Lou Ferrigno and Arnold, that sort of competition and things like that. But really, competition was between Serge Nubret and Arnold. But the problem was that Serge was such a threat that that they basically told him that there was something that he did that disqualified him from competing, and like, you know, a couple, you know, 6 weeks before the competition. So he's like in full prep form, like he's getting just shredded, and he's ready for the, you know, he's you know, aiming for this date, and they say, yeah, you're not going to compete, and he's like, oh, damn it. So, you know, he wasn't doing the same full prep that he was doing, that he'd been doing before. And then 2 weeks before the competition, they said, oh yeah, we changed our mind, actually, that you didn't break the rules and you can compete. And it's like, so he went in, but he hadn't been prepping for like the last month, and so he's doing like a crazy 2-week prep to try to get ready to compete at the Olympia with Arnold and Lou Ferrigno. And in the movie they downplayed it totally. They just pretended this guy wasn't anyway. They said, oh yeah, and there was the last minute entry by a French actor. That's all they said. They didn't even say his name. Just a French actor, and he comes on stage and you're like, Jesus, like, that guy is yoked. I remember thinking at the time, I was like, you know, there's no way that guy's just some random French actor that just happened to be just in that level of physique that he could just walk on and just step on the stage at the Olympia with Arnold. And I looked at him and I was just like, that guy has a better physique than Arnold. Like, I mean, that guy is clearly better than Arnold. Like, what's going on? This is really weird. That was Serge Nubret, right? And they just pretended that he wasn't, you know, that he was just a French actor. Serge Nubret is one of the most prolific bodybuilders of all time. And this was sort of prior to the massive roid era. I think it was just starting. You know, they would use some things, but much less steroids than Arnold used, supposedly, and was bigger and more developed. And there's pictures of them next to each other, you know, on stage, and you're just like, that guy's an absolute unit. Just ate 6 pounds of horse meat a day. Didn't eat anything else, no carbs, anything like that. I'm actually going to be interviewing a guy today who was a bodybuilder back in that day, trained with Serge Nubret, was in there from the inside, and we're going to be talking about all this sort of stuff, what they actually ate. And you know, talking to him, he was just like, yeah, I really like this whole carnivore thing, because that's, you know, that's what we've been doing. It makes sense. You know, we're going through the ice ages. You know, we have all this anthropological data, you know, the stable isotope studies, all these sorts of things. He was aware of all this stuff, and apparently so was Garanda and Nubre, and they were like, yeah, you should just eat meat. And obviously not all these things, like the stable isotope studies hadn't come out, but at that point, but understanding those concepts, and this is just what humans are supposed to eat. So just eating a ton of meat, don't eat anything else. You don't need carbs to put on muscle. In fact, you don't want them, because typically what you'll put on is mostly fat. You make all the glycogen you need. High-level studies with top-level athletes showed that you have the exact same muscle glycogen on a ketogenic diet as you do on a carb diet, even when you're carb loading. And you recover the same amount of glycogen at the same rate as the carb eaters when they're eating carbs and sucking down sugar. And all you're doing is just letting your body replenish your glycogen naturally. It's shown that on muscle biopsies in elite athletes after, before, after, and 3 hours after a 3-hour run. Exact same muscle glycogen scores at all 3 stages, as compared to the carb athletes that were sucking down sugar gels and things like that the whole time. So that's one. Training style, I'm in the camp of high volume. And that's one of the things that you know, looking at Serge Nubret and those golden era bodybuilders and Arnold Schwarzenegger, even Mike Menser says, oh yeah, it's just 1 set to failure and that's it, and only train 1 body part once every 32 days and all this sort of nonsense like that. I'll be speaking to this guy again, but he has, the guy is Dr. Nash Josic, J-O-C-I-C. He was in that era with those guys, and he did follow Menser's advice, and it got not good bodybuilding results. And then he started training with Serge Nubret, did the exact opposite. He was doing like 40 sets of bench just in a row, and he had one of the best physiques ever. And Mike Menser at the time was doing the exact same thing as everyone else: super high volume, lots of sets, lots of reps, and not doing just a one-off every now and then. He never trained like that. So I'm definitely in that camp. When I do more sets, and I never go for just a couple of power lifts or whatever. I always go for the 10 to 12 rep range, or even 10 to 15 rep range. I do go to failure with. There's arguments that maybe that's holding you back, but what I find on a carnivore diet, the main argument is that you're not going to recover in time. You're not going to be able to do as much later. I recover just damn fine. I recover better than I ever have. I mean, I'm doing, similar sort of things. I'm doing 20 sets of bench, 20 sets of dips, 20 sets of squats, 20 sets of deadlifts. So I'd be doing 40 sets of exercises per muscle group, per major muscle group. In the smaller muscle groups, much less. But I had fantastic results, and I recovered. I was doing that every other day, and I was never having a day off. Maybe a Sunday, I'd sort of force myself to stop, but I didn't feel that I needed to. I felt great. This is when I had time to work out for 4 hours a day, but I just felt amazing. And so I had that recovery. Now, the difference was I wasn't doing what Serge did, which he would do 20, 30, 40 sets per muscle group, sometimes even just the same exercise. But he would give himself very short rest periods. So he would still be, still feeling his last set when he started his next set. And that's pretty damn hard. I found that if I gave myself, 2-3 minutes rest, I could just keep going. I'd never need to stop. I just do as many sets as I wanted to. Sometimes I would superset. Maybe I'd do something, I'd do bench, then I do something else, then I go straight back to bench, and then I go do something else, and I go straight back to bench. So I didn't have like a rest period, but I rest that muscle group. So it was still a high intensity. I was still keeping my heart rate up. I was still pushing myself in that way. I wasn't having big long rests just sitting there on my phone. I was doing other things. So I would superset and do circuit training. So I do other things, but I didn't want to just sit there and do bench for 3 hours. What I would do is I would do bench, and I'd do something else, and I'd go back to bench, and I'd do something else, and I'd do back to bench. And so I'd do one set each. So I'd always be circuit training, supersetting, all that sort of stuff. What Serge did is that it's basically a similar sort of thing, but it's just very low rest periods. And I found that works really well to wear yourself out. And so what he would do for upper body, he'd be like 30 seconds rest between upper body lifts, up to a minute maximum, and lower body just 1 minute, 60 seconds. So you time it. Jack LaLanne would do that too, and because he just didn't have time. He's like, hey, look, I've got an hour every day to work every muscle group. Like I can't I can't, do the rest period. So it's maximum a minute. He said that no one could really keep up with him because he had such a short rest period. So I like that. I think that does get you a really good deep workout. It can challenge you, get your workout done pretty quickly. When I was doing that, just working out in that volume, I was able to put on muscle extremely easily. As long as I was eating enough. You have to make sure you're eating enough. You eat fatty meat until it stops tasting good. If you're trying to put on muscle, do that at least twice a day. Maybe you might need to eat more. And you need those nutrients to stack on that weight, on that muscle. And when I was doing that, especially in that really high intensity, that volume, I would do each muscle group twice a week. So I might do, 20 sets of bench, 20 sets of dips twice a week. So I was doing 80 sets twice a week. And that worked really well, and I got pretty lean and pretty jacked. And because I was working at such a high tempo, I was staying around 6% body fat. When you work at that higher intensity, you actually stimulate a lot of hormones like testosterone, like growth hormone. Growth hormone actually helps you lean down and stay very, very lean. It also helps you grow, but growth hormone itself it is really good for fat burning, and then that triggers IGF-1, which helps with the growth and healing and repair side of things. But there's a lot of fat burning when you increase your growth hormone just itself, and that does that. Those high intensity exercises where you're really working yourself hard, that stimulates growth hormone as well. So I still like. I think that it depends on what you're doing. Like if you're able to go 30, 40 sets at a time for a muscle group once a week is what like the big bodybuilders are doing now, and that seems to work really well. If you're not able to do that, maybe you're splitting up those 40 sets between 2 workouts per week. Maybe that gives you a good workout. I would experiment with yourself. It depends on how intense you're going, how much you're able to work out. For me, when I was playing rugby, I found that I wasn't doing 20, 30 sets of each muscle group. But I would do a lot, and I found that I had the best physical results when I, both from a physique and also performance point of view, that when I did each muscle group twice a week. That was just me, but I wasn't doing that like 40 sets of one muscle group and then allowing the body to heal. So I would play around with that, see how much you can work out, and see if try it with one muscle group a week, and really split that out between sort of 4 or 5 days. Go really high intensity. Maybe try it. We split that up, and you're doing each muscle group, twice a week. So it wouldn't be as much intensity, but you're doing it twice a week, and just see what works best for you. Logistically, you have to it has to be something that you can do and can consistently do as well. But that's what I found. I found that I really like the shorter rest periods. I find that gives me a much better workout, and that it's much more challenging. And being on carnivore, that's something that you need, because otherwise it's hard to challenge the body. I can just recover so quickly that this, just giving myself a minute rest for legs and 30 seconds rest for upper body, that starts to challenge me. And I start to, really wear out, the muscles and fatigue them properly, so that I get a really good workout in. At the moment, I'm still working out twice a week. I like that. I don't know, but I might play around with just doing one muscle group once a week and just really crushing it on those days, and see how that goes. But at the moment, I am still doing two muscle groups a week, but then again, I don't have 3 hours to just kill it at the gym. I've got to sort of just get in there and just do something intense and then get out of there, because I just don't have time. And so doing that, but doing a couple times a week, that seems to work well for me at the moment. But that's something I'm going to play with. So, and that you should play with that as well. But the main, big bodybuilders, if you're trying to build a big physique, that's different than trying to build an athletic. Build athletic performance or something like that. Is different training methods, right? So if you just want to build muscle and lose fat, that's what the top bodybuilders are doing. And that's what the old school bodybuilders did. But like Serge Nubret would do twice a week, I think. And the sort of argument there was like, well, he was sort of a freak of nature, and not everybody can do that. But he was basically carnivore for a lot of that, and we're carnivore. So is that going to be slightly different? Are we going to recover faster? I feel like I recover pretty much straight away. And so I was actually doing 40 sets, maybe sometimes 60 sets of one muscle group 3 days a week, because I would do a split where I'd split my upper body groups between 2 different sessions, and then I'd have like just a dedicated leg day, and then I'd start it again. And so, or there was a time there, no, sorry, that's what I did later. I worked in legs and things like that with it, but I might do like, so I had 2 days. So I sort of basically do the whole body between these 2 days, and I would have no rest. And so like Monday I would say I was doing like chest and all that other sort of stuff associated with it. Then I do it Wednesday, and then Friday, and then Sunday, and then all this, or I had Sunday off, and then I'd start back up on Monday. So I'd be doing that chest 3 days a week, and I might be doing 20 sets of bench, 20 sets of dips, 20 sets of flies, 3 days a week. And I did that for months. And I got to the point that I actually started getting like tendonitis in my chest. I was like, oh, no, that's not good. And I actually had to slow down. So eventually I started hurting myself. I actually started getting injuries. Just in the pec, everything else was fine. And so then I was like, okay, well, looks like you do need some rest period. This is too much. But I'm doing 40 to 60 sets, right? So I might do flat bench one day with dips, and then the next day I'd be doing incline with dips and things like that. So, that's a lot. That's a lot. And it took months before I started actually getting strain and tendonitis in the pec, which actually I kept working on it, but just with lighter weights, and ended up healing within a couple weeks actually. But months. I mean, it took months to do that. And so I just put it back to twice a week after that, and I felt fantastic. But my body recovered so much better because I was on carnivore, and I never got sore. So it wasn't like I was just dragging. Oh my God, I can't believe it. No, I was fine. So there might be a difference for carnivores, and that's actually something I'm going to ask him as well, and pick his brain on that. Okay, so question from Luz. Thank you so much for the very generous super chat. I really appreciate that. They asked, Luz asks, carnivore for 5 months. At first I felt great. Over the period had brain fog, bloating, joint pain, bit depressive, and have some weight gain. Besides butter, no dairy. I train 5 to 6 times a week, but still feel sore and no more change. Interesting. So, if you're still getting sore, I mean, there's probably something that's in your system that's causing that soreness. You could cut out the dairies, the butter, I should say, because some people do have problems with that. So it sounds like you felt good at first, but things have started to sort of crop up. I mean, I would just cut down to brass tacks. And just cut out everything except meat, salt, and water, salty to taste. So cut out the butter, just eat just the fat from meat. I'll try to eat, a lot of fat, and try to get, make sure you're getting enough, make sure you're eating enough. You can gain weight for a number of different reasons. Obviously, you can gain muscle, and that gains weight. I assume what you're talking about here is you're putting on a bit of fat. It could also be because of your training styles. If you're working out, if you're overtraining, things like that, you can sort of slow yourself down. If you're doing that high intensity, like I mentioned, where you are just giving yourself very short rest periods, that triggers fat loss and lipolysis and growth hormone production, so that you're actually could stay a bit leaner. So giving yourself much shorter rest periods, basically as little as possible, so you can recover, so that you can then go and do it again and do it again and do it again. I'll cut out everything else. Sometimes you have to sort of, obviously you want to get the right amount of protein for your to get the best results in the gym, and to get the most out of your work in the gym. But at the same time, if you increase your fat, that actually can trigger FGF21, which is a hormone that triggers lipolysis, and you can actually burn more fat. And so actually increasing your fat to protein ratio, and getting your protein by percentage of calories down below 9%, which is not necessarily the best thing to do if you're trying to bulk up and put on maximal amount of muscle, but it will trigger lipolysis, and you can shred down and get leaner. But so you can play around with those sorts of things as well. The brain fog, the bloating, the joint pain, that's pretty atypical for people going on carnivore. So it could be that something's sort of introducing itself in that you sort of haven't sort of noticed, and sometimes that has even like people taking the different electrolyte drinks that maybe have some flavorings and things like that. Not saying that you're doing that, but those sorts of things, all of a sudden people say, well, you need electrolytes and you have these things, and all of a sudden you don't feel as good, and you don't associate it with that. So that could be just, so if anything else is slipped in, just cut it out and just go down to just fatty meat and water. Make sure you're eating enough, eat until it stops tasting good. But yeah, the bloating and joint pain, that's a bit atypical. The other thing that certainly brain fog and joint pain can be precipitated by would be things like oxalate dumping and losing all these oxalates that you've stored up over the years. Your body's trying to get rid of now, and that can absolutely hurt your joints. Actually, one of the causes of gout is oxalates. That's a known cause of gout, or now called pseudo gout. Training 5-6 days a week but still feeling sore. It's there has to be something that's getting into your system. You really shouldn't be sore if you're just eating meat. It's coffee. I mean, you'll be sore for 2 days after 1 cup of coffee. And these are some things that people don't always attribute. They think, well, that's fine and that's okay, and coffee's good for me. I mean, I had one person say today that their doctor said they weren't happy with them going full carnivore. They had to at least drink coffee with some cream. It's like, what? Like, the hell are you talking about? Coffee is now an essential nutrient or something like that. Like, the hell are you talking about? So coffee is a major one. Coffee will absolutely cause soreness, and a lot of people continue to drink coffee on a carnivore diet because they like it and they enjoy it. I don't drink coffee because I'm sore for 2 days after I drink coffee, and I also notice in my patients that if they drink coffee with their medications, they don't absorb their medications, and we can measure this in their blood tests for certain things. And so we see, like, hey, look, your thyroid levels are way low and you're symptomatic. What's going on? Did you stop taking medications? No problem. No problem there. I had a couple dozen people come into me in about a 6-week period last year, all had that scenario, and every single one they were having coffee in the morning around the time they had their medications, and we, through trial and error, we found out that they basically had to stop taking, or they had to delay their coffee by at least 2 hours, or else they just wouldn't absorb their thyroid medication. And if they're not absorbing their thyroid medication, what makes us think that they're absorbing anything else properly, right? So I would just cut out everything. It sounds like there's something in your system. Even if you're overtraining, you still shouldn't get sore. You can get tired, you can get run down, and your body may not recover as well if you're overtraining, but you shouldn't get sore. And so I would really think hard about, is there anything else that you're doing besides eating meat? If there really isn't anything, then this would be more suspicious for something like oxalate dumping, because you can get all those symptoms from oxalates. And so even the depressiveness and things like that. But I would be very suspicious if there's something else in there. I mean, even just the butter. I mean, just cut that out. Some people don't do well with butter, and so just cut it out. And then see how you go, and just cut down to just meat and water. If that's not doing the trick, then start thinking about oxalates, and then you take a look at Sally Norton's work in my interview with her, and sometimes adding in a bit of oxalates, even 50 milligrams, a bit of sort of wheat green tea or something like that, that can actually suppress the dumping and actually sort of help waylay your symptoms. And if that does help, then okay, great. Do that when and as you need it, in order to help those symptoms calm down, and then your body will just sort of eventually work this stuff out of your system. But it can take a while as well. But first protocol, cut out absolutely everything except beef, lamb, and water. Even the chicken and pork and eggs and things like that, you never know. Something could be triggering something. Just beef, lamb, and water, no dairy, no nothing else, and see how you go. And good luck with that. Hopefully it just settles down on its own. So nobody here. Thank you so much for the super chat. I really appreciate it. Type 2 diabetes, keto for 1 year, then 90 to 95% carnivore for 4 years. Hey, awesome. 100% carnivore except for coffee. See, there you go, coffee for 10 months, eating 2 times a day, 250 grams of meat, 3 eggs regularly, raises blood glucose 3 to 5 millimole. Why is that? Like raises it by 3 to 5 points, or the range of 3 to 5. I'm going to assume that raises it by 3 to 5 points. So eating 2 times a day, meat and 3 eggs, and regularly raises blood sugar. Type 2 diabetes should be pretty well in remission by now if you are, you've been ketogenic and for as long as you have. But there's sort of some lingering sort of insulin resistances and things like that. You maybe have a bit of a bump, but I wouldn't worry too much about that. I'd sort of look at what your average is over time. If you're having if your blood sugar goes up transiently and then comes down, that's okay. Even from exercising, your blood sugar is actually going to go up. That's normal. That's physiological. Your blood sugar is going to go up somewhat. It really shouldn't jump up to 10 or 12 with just eating meat, but maybe that your body's just still recovering, and checking your insulin. Maybe you had a problem and burnt out a lot of your insulin production capabilities, and that's making it more difficult for you to to normalize your blood sugar. But that would be more likely to be the case if your blood sugar was always running a bit high. So if you had low insulin, but you had regularly high, consistently high blood sugar, even when fasting, that would be suspicious that your pancreas is a bit burnt out and not making enough insulin. So I would think about that. And if that's the case, then certainly go see your doctor, get your insulin checked and all these sorts of things. But if it just goes up a bit after you eat and then it goes back down to normal, I wouldn't worry too much about that. If you find that it's specific things like eggs that trick it off, then maybe just cut them out. And if other sort of meats or getting more fat in there, increasing your fat content to sort of 80% calories from fat, that sort of thing, then see how that affects your blood sugar as well. Also, it's has been shown again and again, even in normal carb eating populations, that just going for a 20-minute walk after you eat can significantly lower your blood sugar and just keep that down. You're just using those muscles, and the glucose is getting into the muscles as opposed to just sitting around marinating in your bloodstream and causing glycation damage. So think about that. Maybe do something along those lines. Also, think about what you're measuring that on. Is it the finger prick blood test, which is usually pretty accurate, but just make sure that your device is calibrated properly. But if you're doing a CGM, CGMs are notoriously hard to calibrate, and they can show a couple points higher or lower, usually higher than what is actually there, and then you check your finger prick, and you're like, your blood sugar says that you're at 8. You're like, oh, that's not good on your CGM. But then you do a finger prick, and it shows that you're at 4. Like, okay, that's weird. Finger prick is what you're gonna take as more reliable. That's typically more reliable than the CGM. So that's the other thing too. Is it's just on a CGM, maybe that's not as reliable, and so check it, calibrate it, make sure that's reading properly. Go for walks after the meal. See if it's something to do with the eggs, or maybe you're just eating something that's very lean, and maybe that's triggering this response as well. Try eating more fat, things like that. So try and play around with it and see how that can affect it. And again, make sure that your machine is calibrated properly. This question from Julie. Thank you so much, Julie, for the super chat. Hi, Dr. Chaffee. Your thoughts on carnivores that eat sticks of butter? Butter is a really, really healthy nutrient source. Not everybody can tolerate it, especially people with autoimmunity. Needs to be mindful of that. Most people, even with autoimmune issues, do fine with grass-fed butter, but not all do, and so that can be a problem. You do absorb as much. You absorb a certain amount of fat. Your body has bile that helps digest, break down, and emulsify and absorb fat. Once you run out of bile, you will only absorb 10% or less of the fat that you're eating. Usually those are MCTs and things like that. So if you're like drinking MCT oil, sure, you'll absorb a lot of that, or more of that. But if you're just eating whole fats like butter, most of that's going to go out, and most of that's not going to be absorbed. And so I don't get too worried about people eating butter if they feel that helps them. But not everybody needs it. Not everybody wants it. Some people find that it can cause inflammation and cause a bit more of an issue with their autoimmune issues in particular. Sorry, this might be a bit annoying. Oh, there we go. Okay, so maybe that stop moving. There we go. All right, it was just sort of like slowly creeping down. I'm like trying to follow. It was pretty weird. So, I mean, I would just go individually. I mean, I don't eat sticks, but I do use butter, and that works well for me. And so I have a big chunk of butter onto a steak, which makes it taste delicious. I'll cook eggs in a lot of butter, and I'll sort of fold it into the eggs, like scrambled eggs, so that it sort of has the fat in it, so it's not just sort of separated. Those sorts of things, and I eat a lot of fat. So, if you want to eat butter, and I don't think there's a problem with that, because you're only going to absorb the amount that your body can absorb, and so it's sort of like an overflow valve. You're not really going to be able to overdo it, and if you do, you'll just get stools, and then but that's not you being sick. That's not a problem. That's just inconvenient. So I would just say, really individual. I don't think it's a problem per se. It definitely is confronting to people. It's like, oh my God, how can you just be eating butter and all that sort of stuff? That can't be good for you. That's actually very good for you. It's very healthy stuff. Do you necessarily need to just eat chunks of butter? Hopefully you're getting the fat that you need from just your normal food. But if you're not, then supplementing with butter, adding more butter, usually hopefully on your food. But if you have to just eat chunks of butter to get the fat content that your body needs, I don't think that's the worst thing that people have ever done, as long as it's not a problem for you from an inflammatory point of view, from an autoimmune point of view especially. And so if that works well, then that's great. Sometimes that you may not absorb it as much. Some of the fat that's in the cellular structure is easier to absorb because it takes longer to break it down and extract that fat, and so you absorb it more easily because it gives your body more time to break it down and absorb it. Whereas if you're just eating a lot of butter or tallow or that rendered fat, then that can actually get through your digestive tract much more quickly, and you can get problems with absorption. You get like loose stools basically, and so just keep an eye out for that. And if you're having that, then obviously pull back on that sort of stuff as well. If you're getting sort of inflammatory sort of issues, especially autoimmune issues, definitely pull back on that. But just try it. If you're not adding in butter, look at how you feel. Try and add in more butter. See how you feel. Do you feel better? Do you feel worse? Do you feel the same? Take a look. You can add this stuff in, take it out, and just see, and just do sort of an N of 1 test, which is really the only important test. What does this do for you? How does this make you feel? If this is making you feel better, great. Or improving your health, and that's why you feel better, then great. Obviously, you feel great taking drugs, don't do that. But doing things that make you healthier, if that's making you healthier, great, do that. And if not, you try adding in the butter and that doesn't make you feel as good, then don't do it. Just because it's something that some people like doesn't mean it's for everybody. Has these inflammatory proteins and things like that, much less so in butter, but that can still cause problems for some people. So just if that's you, then avoid it, and if you feel better with it, then great. It's a good source of nutrients. Grass-fed is going to be objectively better. So grass-fed butter has 3 times the amounts of vitamin D3 that non-grass-fed butter has, for instance. And so it's got a lot of those fats, and the quality of the fats and the fat-soluble nutrients that are in there are going to be better on grass-fed butter. So definitely do that. If you're going to eat butter at all, do grass-fed if you can get it. So Healthy Happy MS, thank you so much for the super chat. 70-year-old female, week 12, lion carnivore, 100% beef, water, salt, no coffee or sweeteners, not even toothpaste. Very good, very well done. Yeah, I use baking soda quite a lot of the time. Certainly don't use anything with like fluoride and a bunch of sweeteners and flavors and things like that. There are natural toothpaste powders and things like that have much less stuff in them, and that's what I stick to. But often you just use baking soda. It's really good, or the tooth powder from Stone and Spear Tallows, who I work with, works great, and that sort of thing. But yeah, so fatty meat, 1 pound plus a day, and fat trimmings to bowel tolerance. Perfect. Moderate EDSS 7 MS, which was, is this? Maybe saying 1 of 2. Maybe there's another one here. Let me see if there's something else. Do we know if she had a second half to that? Let me see here. I'm not seeing the second half. Happy Healthy MS. Where's that? Where's the second half? Yeah, it's not in the super chats. Let's see. Okay. So well, while we're waiting for that, I'll just oh, here we go. God, just went right over it. There we go. Okay, so was diagnosed 43 years ago with MS, and diagnosed 43 years ago, SPMS, last 24 years. Given the duration and severity of my MS, is it okay to try ghee at this point? And if I don't react, try raw grass-fed A2 butter. No changes yet, in for the long haul. You could, you know, but you're sort of rolling the dice, aren't you? You know, I mean, and sure, you know, if it sort of gets a flare or something happens, then you can always come off of it. But you know, the thing I worry about is what if it's much more subtle sort of issue. It's damaging things to a point that it's sort of holding you back, but it's not to the point that you have a massive flare and you're very symptomatic and all these sorts of things. So that's my concern about something like that. Ghee is usually fine. I mean, ghee takes out all those milk solids that people would typically react to with autoimmune issues. So that's usually fine. The grass-fed A2 butter would be a better option than a lot of those things. But you just have to sort of just be cautious about that. You know, I mean, you will always do best with exactly what you're doing now, and so that's really good. And hopefully you found a lot of improvements from that. Be really interesting if you've had follow-up MRIs, you know, before and after you went carnivore, to look for improvement, because a lot of people are getting improvement. They're actually reversing their lesions. Their lesions are actually improving. So that's the best way that I've seen people deal with any autoimmune condition, especially with MS. I would be optimizing your B12, having a couple ounces of liver 3 days a week, and maybe some other organs, just making sure you're getting enough B12, vitamin D, getting out in the sun, and all those good healthy fats like the DHA and EPA, choline, creatine, carnitine, saturated fat, and cholesterol. All these things your brain needs to remyelinate your nerves. So that is the best way. If you did want to add in a bit of ghee and see how you went, I mean, that's certainly something that you can do, but just be mindful. Maybe get an MRI first and see what your lesions are doing, and then you add in the ghee. And even if you don't feel that that's causing a problem, and you check your MRI and be like, oh, actually it's not improving as fast as it was before. I wonder why that is. Could it be something to do with the ghee? Could it be something to do with butter that you added back in? Even though you don't feel that something was worse, maybe it slowed down your progress, even if you didn't flare up, things like that. But have some way to objectively measure that. Get an MRI now. So if you have an MRI before you started carnivore and you have an MRI now, you say, oh, wow, look at this. You have 40%, 50% reduction in lesions, which is happening. We're seeing that in 8 months to a year in some cases. And and then say, okay, well, I've gotten that much progress. Now I'm on ghee and I feel fine, but actually it's not shrunk down more than that. Wouldn't really expect that. Or maybe actually the lesions have grown a little bit, but they're just subtle enough that I didn't notice it symptomatically. Things like that. Have some sort of objective measure that you can gauge that from and see how you go. There's another follow-up question from her, which is, would it be deleterious to do a 72-hour fast? Prior to carnivore, I did a 7-day water fasts twice a year for MS, neuroregeneration, as per Walter Longo. You get all those benefits from just being in ketosis in the first place. I don't think it's deleterious to do that. I think it'd be fine. I mean, just remember that you're trying to regrow your nervous tissue and your myelin sheath. You don't do that by fasting, right? I mean, your body heals during that time as well, but your body uses the nutrients you get from proper food to regrow your myelination. You don't get that otherwise. So you have to have B12, D3, DHA, EPA, choline, creatine, carnitine, yes, saturated fat, and indeed cholesterol as well. All those are essential nutrients for the brain. You cannot make myelin sheath, your myelination around your axons, which MS is a demyelinating disease. It destroys the myelin around the axons. So you need those nutrients to regrow that myelin. When you're fasting, you're not getting any nutrients, right? You'll still have nutrients, but is that fasting period, is that really what's going to spark this? You're already doing it. You're already going through autophagy, mitophagy, regeneration when you are in ketosis generally. I don't think it's going to hurt you though. 72 hours, I think, that's not going to be a problem, but I would definitely make sure you're refeeding and getting enough of those nutrients on those days that you are eating. So, I mean, the thing with fasting and neuroregeneration is that, even Longo himself has actually shown that fasting mimicking diets, and what the hell is that? So the diet that puts you into a fasting state, which is really misnamed. It's just a carbohydrate metabolism, non-carbohydrate metabolism. But that fasting state is not a fasting state, because when you eat 5,000 calories in ribeye, you're not fasting, but you're in that same metabolic state. So whatever you can say about that metabolic state, you cannot say that it is a fasting state. So that's just our primary metabolic state. When you're in that metabolic state, your body is healing and repairing and regenerating anyway. Will it go faster if you fast? Maybe. It's really hard to measure that. You really can't measure that properly. And so, there's no real way of telling if it goes faster being in just on a ketogenic diet versus just not eating. We don't know that. And I mean, people have definitely said that, but where is the metric? Where are the studies that show that? I mean, you have to do like a biopsy and look at it under an electron microscope and actually look at what's happening in the cell to see, if it's going through autophagy and things like that. And, certain sort of assays and Western blot tests and things like that. Looking at these sorts of things that you can sort of tell that autophagy is happening, mitophagy is happening. There's sort of blood markers that are much less accurate that are involved, and even just sometimes just being the amount of ketones that you're producing can be indicative of how much autophagy you're going through But at the same time, that's not always so clear too, because after 6 months on a ketogenic diet, your ketone levels are down naturally. Even though you're producing the same amount, your serum levels will be lower because you're utilizing them, you're using them more effectively. So there's no real good way of testing that. And Longo himself has studies showing that just doing ketogenic diets, a fasting mimicking diet, that's a ketogenic diet, that that has the exact same benefits in for a lot of these things compared directly against fasting. That if you just do a fasting mimicking diet for that same period of time that you would be fasting, you get the same results. That's what his own studies show. So can fasting help in certain circumstances? Sure. Does it help more than just not eating the wrong thing and being in ketosis? I have my doubts. Maybe certain select situations, but that's about it. Is it going to hurt you to fast for 72 hours as long as you're eating enough on the other days? No, I don't think it will. We're more than capable of doing that. Our bodies are fully capable and adapted to not eating every single day, as all predators in the wild may face days or even weeks without getting a kill, a successful hunt. Humans have been super predators. And we've been so successful that actually there's large civilizations that have never actually had to go a day without food if they didn't want to. Native Americans in the Columbia River Basin in Washington State, they had these weirs and nets set up and had such a thick salmon run year round that they had fish at all times. And if you calculate the wealth of a civilization based on the amount of leisure time to work time that they have to, the amount of time that they have to work to take care of basic necessities, food, water, lodging, all that, shelter, things like that, compared to the amount of leisure time they had, that this population was the wealthiest civilization that's ever existed. They had basically all their time was leisure time. And so the idea that no, we need civilization, we need agriculture in order to have crops so that you can have these cities and you can have that leisure time so people would think deep thoughts and calculate the distance to the sun with triangles and things like that. No, you don't. You can get plenty of leisure time by eating meat. And so the Native Americans, the Great Plains, they did that as well. They had buffalo drive in one big hunt a year. They had meat for the entire year. They dried that meat and saved it for the whole year. And we have evidence of people doing mammoth drops for over 1 million years. So it's very likely that many civilizations never had to go a day without eating unless they chose to. And some people do. They're like, I'm just not hungry. I don't eat every day. Why would you? The Mongols, Genghis Khan, I mean, they would often ravage the countryside for 5 days straight without eating, and then eat 10 pounds of horse meat in a go, and then boom, do it again. So, it's definitely something you're more than capable of. And if you're eating enough and maintaining and optimizing your nutrients on those other days, then I don't see any problem with that. Do you need to do that? I have my serious doubts. I don't think it's necessarily going to help you. I don't think it's going to hurt you either. It may confer some sort of benefit, and if it does, great. If you want to give it a try, then that's fine. If you find that that's helpful and beneficial, it's hard to say because these nerves take so long to heal. We're talking months and months and months. To get 40% resolution. I had a patient that took 8 months to get 40% resolution. Had Dr. Sarah, who was on my podcast, 6 months. She had 50% resolution, shrinkage of her lesions, which is amazing. She was optimizing her nutrients. She was taking high dose vitamin D. She was making sure she had enough B12. She was doing all these other things as well. So that helped optimize things also. So, and obviously I was doing that for my patient as well, although I didn't have her on 70,000 units of vitamin D, like some people get put on. But I think Sarah was on like 75,000. I used the vitamin D3 with K2. I just got my patients' levels up to optimal levels, as well as the B12 and all these other sorts of things as well. So that takes months. I mean, 6 months to a year to see any sort of significant difference. And so doing just a 72-hour fast, how are you going to measure that and how successful that was? It's really hard to say. If you want to do it, I don't think it's very. I don't think it's going to hurt you as long as you're eating enough on the other days. There's a question from Sophie Point, who says, "Hello, Dr. Chaffee. I understand the vitamin D3 supplements in winter, but as for K2, do we get enough in fatty meat, or do you recommend a supplement?" If you ever take a vitamin D3 supplement, you should take it with vitamin K2. They go together. They work together. They both come from fatty meats. You're getting high quality animal fat. Even in the winter, you should be getting a decent amount of vitamin D and K2. If you're very low on D3, you could very well be low on K2 as well. So I would be mindful of that. And if you are ever going to supplement D3, I would always take it with K2. So the typical recommendation is for every 10,000 IUs of vitamin D3, you take at least 100 micrograms of K2. And sometimes supplement forms that come with K2, if they're separate, might be a bit different. It might be 160 or 200 or something like that. That's fine. It's just be in that ballpark at least 100 micrograms per 10,000 IUs of D3. Quite often they'll come together. I mean, it's rare. It's more rare now to see a vitamin D3 supplement that doesn't come with K2, and so just take it in whatever proportion that it comes in. But the other thing is that the oils that it comes in matter. So typically you want to find something like MCT oil. You definitely don't want the canola oil, sunflower oil, soybean oil, that sort of garbage. Even though it's a small amount, you don't want any of that stuff in your body. Oh, it's just a small amount of lead. Great, keep it over there. And then the other thing is that vitamin D, D3 that you get in your supplement is a slightly different chemical form than you actually get from the sun or from food. And it does have different solubility in your body, and it works differently in your body. Vitamin D is a hormone. It's not a vitamin. It's really misnamed that. It has over 1,000 different functions in your body. It's really important. It has a lot of hormonal impacts on your body. Like during puberty, this is what broadens the shoulders in men, narrows the hips. You have that sort of classic V-shaped appearance. So you have a thin waist, thin sort of physique with broad shoulders. And then women, it narrows the waist, broadens the hips. You get that hourglass appearance, that the sort of classical feminine form that you'd see in sort of Greek statues and things like that. That's vitamin D during puberty. It also has to do with bone deposition, bone mineral density, and so on. If you have deficiency, you get osteomalacia, also called rickets. You get these soft bones. And giving somebody vitamin D supplement does cure rickets, right? So we know that it has some of these hormonal responses and bone health benefits from taking supplemental D3. Is it going to have all of the benefits you get, all the different over 1,000 different things that vitamin D does? Probably not, because it is slightly chemically different, and it does have different solubility, and also you make vitamin D on the surface of your skin when you're exposed to sun, and it stays there for up to 48 hours. Everybody knows that, and that's why you can't shower directly after being in the sun, because you wash off all that vitamin D. Oh, you only 15 minutes of sun and you get all this. Only if you have enough cholesterol, because vitamin D is synthesized from cholesterol. So all these vegans going around saying, "Oh, we get plenty of vitamin D." No, you don't. And then also, if you're in the sun and then you go and take a shower, you're going to wash that off, because that vitamin D is in the oils in your skin, on your skin, and then soap will wash it off. Most you want to do is sort of rinse off or something like that if you're really sweaty or something. But you will wash off the vitamin D if you shower with soap. So that's the other thing. People like Jack Cruz is strongly of the opinion that the vitamin D that you get from supplements is just not good enough, and I would agree that there's definitely it's definitely very important to get that from natural sources. It will have some of the hormonal benefits that we get from vitamin D, but not all of them. If you're extremely low, any port in a storm, just get that up, and then focus on the natural ways of getting your vitamin D up. So the animal fats, so grass-fed finished, grass-fed butter, again, 3 times the amount of vitamin D3 as non-grass-fed butter. Get out in the sun, even though it's winter. Just get out in the sun, get out in the light. The light is actually an important nutrient. It's not just vitamin D, it's so many other things as well. And UVA is very your brain and your body and your cardiovascular health and your brain health. It stimulates BDNF, brain-derived neurotrophic factor, if it gets into your eyeballs, not through glasses or screens. And yes, the vitamin D, you might still get some in the winter, but just not as much. So get more like that. If you're very, very low, then supplementing is fair enough. Just again, any port in a storm, but you're best getting it from your natural sources. And that was the thing about Dr. Cruz. I saw him say once that the vitamin D3 on the surface of your skin actually sort of acts as like a Faraday cage and sort of blocks out different EMFs and things like that could be damaging to you. It sort of has that natural sort of protection, electromagnetic sort of protection against all this sort of stuff, which is when you're out in nature, that's one thing, and it's sort of you're getting more of this vitamin D protection anyway. But now we're indoors all the time, we're surrounded by electronics, we're getting more exposure to these EMFs, and we're getting less exposure to sunlight, so we're getting less of that vitamin D on the surface of our skin, so we're actually getting less protection as well. So definitely better to get it from natural sources, but if you need to take some, I would always take it with vitamin K2 as well. Thank you so much, Cheryl C Designs, for the super chat. I really appreciate it. Sherry. She says 59-year-old female, not on HRT, reverse type 2 diabetes, lower blood pressure, off all meds, no more joint pain, migraine, auras, tinnitus, brain fog, fatigue, anxiety, IBS-C, lost 150 pounds and 40 to go, tons of energy, loving life. Wow. That's amazing. Thank you so much for sharing that. That's absolutely fantastic, and it's so good to see. And that's something that we would look at this and go like, yes, that's what I would like. But the great thing is that most people do achieve that as long as they stick with it. If not everybody, really, because the food that we're eating is causing these problems, and you get rid of that garbage and you start eating properly, and the body just starts working. Just amazing. So congratulations. Thank you so much for sharing. Thank you very much for the super chat, and I'm really glad that you're doing so well, and keep up the great work. You're doing awesome. So super chat from Fabian Silla. Thank you very much, Fabian. I'm not seeing a question attached. So let me sort of scroll down and see if there's something down here which I'm not seeing. Okay, not too sure. Not seeing it anyway. So Fabian, maybe if you pop the question up again, maybe we can see it and start, and I can catch that then. Also, someone was saying that I keep freezing up. I don't know what's going on with that. It's saying the internet connection is strong, but it may not be perfect. I can try running it off my phone, just because sometimes the internet here is just a bit weird. Let me just try to switch to that now. So there might be a bit of a blip, but let's see about changing that. Hopefully this doesn't disconnect me completely, but we'll see. So, okay. All right, so that's running on my phone now. Hopefully that's better than the house, even though that's just really silly, that internet, because it's like good sign for Telstra, because that they're the internet providers here in our neighborhood in Perth, and it's just really shoddy. It's really shoddy internet. We're paying for the highest speed and all that sort of stuff. We never get anything close to that, and everything's really pretty hit and miss, and it will drop my connection like in the middle of an interview or of a live and stuff like that. So I have to just run things off my phone, which is a bit absurd. that would be the case. Usually, it'd be like your phone may not get very good service, but the expensive internet at your house should definitely be better. So hopefully this is better and doesn't cause any other sort of issues. So next question from Valentina Dima. Thank you so much for the super chat, Valentina. Question, cholesterol 745, HDL 100, LDL 649, triglycerides 54, A1C 5.5, insulin 0.8, C-peptide 0.8. Should I worry about low insulin and peptide, or the cholesterol 745? Look, if your insulin, regardless of what your insulin is, if your blood sugar is optimal, then that's all the insulin that you need. If you didn't have enough insulin, you would get hyperglycemia, you would get high blood sugar, you could get very sick, you could get DKA, diabetic ketoacidosis. You would not be able to put on any weight, you'd be just shredding fat. Then you could eat 50,000 calories a day and you wouldn't be able to put on weight, you'd just be losing weight the whole time. That's if you don't have enough insulin. So if your blood sugar is normal, you're healthy, you're not getting crazy thirsty, you're not peeing like mad, which is you get polydipsia, polyuria, where you're insatiably thirsty. People are licking up water on the bathroom floors and things like that because they're just so desperate for water. I mean, like, really, it sounds horrible, but people do it. Or drinking out of toilets and things like that because they're just so desperate for water. And they're just peeing like crazy because they're just losing so much water from the glucose spilling out. And but you would have crazy high blood sugar. So A1C is only going to track the last 4 months, 3-4 months. And but if you check your blood sugar right now and it's normal, as in between 4 and 5, great. If it's 30, or 20, then that's a problem, right? And you're having, really thirsty and all that sort of stuff. So 0.8, I don't know what reference rate that's using. I don't know what units that's using, so I can't really comment on that. I don't know. I mean, if you are getting all the other symptoms that you would associate with like a type 1 diabetic, where your body's just not able to make insulin properly, and your blood sugar is high, and you're crazy thirsty, and you're peeing all the time, you're just shredding weight, I mean, like kilos a day, then you obviously need to go get checked out and check out and go and talk to a doctor and get that looked at. If everything's fine and you're feeling healthy and great and your blood sugar is normal and there's no other issues, and you're able to put on healthy weight and things like that, then you have the amount of insulin that your body needs. And even if it's lower than others, that's fine. My insulin is on the lower end of the scale, and people might say, "Oh, actually, you want to be between 6 and 9, and mine's 3.5, but I'm ketogenic, so I have very different insulin demands than someone who's eating even moderate carbohydrates." So again, I don't know what units you're using, so I don't know if that's 0.8 the scale of my 3.5, or if my 3.5 translates to your 0.8, because I don't know what units you're using. But it's the whole picture that matters. If your insulin is what it is, or on the lower side of whatever, and your blood sugar is dead normal or even optimal, that's fine, because you are obviously making the right amount of insulin for your body, and you're just very insulin sensitive, and you don't need more insulin. If you had more insulin, your blood sugar might actually drop and might go too low. That would be its own problem. So the rest of that clinical picture really matters. And any concerns, do talk to your cholesterol. I have much less concern about. In fact, I think your cholesterol panel looks really good. Your HDL is fantastic. Your triglycerides are fantastic. Your HDL is double your triglycerides, which puts you in a very low risk category for cardiovascular disease. Total cholesterol and total LDL, actually higher the level, is associated with longer life and living longer, lower cardiac cardiometabolic issues, lower heart attacks, lower death from heart attacks and strokes, as shown on randomized controlled trials with thousands of human patients, like the Minnesota coronary experiment. Higher LDL had lower heart attacks and strokes. Lower LDL had higher heart attacks and strokes. That's random trials showing that. So that's what the data shows. So obviously your own personal clinical picture is your own, and that's, I'm just speaking generalities. I'm not giving you direct medical, specific medical advice. This is just general. But that's what the randomized controlled trials show, that higher LDL actually is lower rates of heart attacks and strokes. There are quite a lot of studies, especially out in the last 10, 15 years, that show that, again, higher total cholesterol and higher LDL is associated with lower rates of dementia, lower rates of Parkinson's, certainly lower rates of infectious disease mortality rates, and lower rates of cancer mortality rates, and of all-cause mortality, meaning you live longer if your cholesterol is higher. The lady that just passed away, she was the oldest woman in the world. She was 117. They did all this workup on her, going, oh, wow, look at this and look at this. And they just conveniently didn't put in the main paper that her LDL was high, right? High, according to them. They hid that down at the bottom of the supplemental information. That you had to dig and dig and dig and find this stuff out. And her LDL was high, right? And not even like just a bit of it. It was high, not necessarily 600 high, but it was high. It was in the high range. It was in the red range for LDL, according to them. But who are they really? It's just that they're sort of the self-anointed, as Thomas Sowell has said, that these people have basically declared themselves the grand poobahs and arbiters of truth, and they aren't necessarily. So I don't worry too much about that. The cholesterol has never been shown, ever been shown, to have a cause and effect relationship with cardiovascular disease, ever. And more data is coming out that actually higher is better than lower. If you just stop eating for 5 days, your LDL is going to go up, your HDL is going to go up, your triglycerides are going to come down, your total cholesterol is going to go up, and that's what your body wants it to do physiologically. So I'm of the opinion you just let your body do it. If we're just saying arbitrarily that no, we want our blood pH to be 3, that's a better place for our blood pH to be, and we know better. Our body's just trying to kill us by trying to keep it between 7.35 and 7.45, and we have to fight against it, and we have to, we don't want it to be acidotic, or alkalotic, we need it to be acidotic, and so we need to force it to do that. That's basically what you're doing here. You're forcing your body away from what it is physiologically trying to do, which makes no sense from an evolutionary biology point of view or physiology point of view. Your body knows what it's doing. You don't need to micromanage these trillions of different processes that are going on in your body at any given time. If it's a one-off here and there, sure. But for the entire population, the entire species, our body's just trying to kill itself constantly. And thank God these pharmaceuticals came around in the last 50 years that could help us change this flaw in our body that God and nature has screwed up, and that we need to fix with science. Science tells us that we're fine and there's no danger in the first place, and that would not make sense from an evolutionary biology perspective. That if you naturally were making high amounts of cholesterol that were just killing you, there'd have to be something as well. But the body selects for reproduction in the early 20s, not for longevity. Well, our genetics are our genetics, and whether or not we've been selected for living longer or shorter, we are designed genetically to live 120 years on average, and yet we're dying in our 60s and 70s. That's because we're designed to live for 20 years, right? And so something's going wrong. We're hurting ourselves. And it's not from cholesterol, right? Because we've always made this amount of cholesterol, and yet people are living, getting more diseases. They're getting sick. They're getting heart disease. They're getting cancers. They're getting diabetes. They're getting autoimmunity, and they really have never gotten them in these numbers before. And in some populations, they don't get them at all, even today. And then they start eating a Western diet, and then they get them, and they get them in spades. But saying that, like, well, yes, high cholesterol, maybe that's what our body wanted to do, but it's basically optimizing us for having kids early on and then reproducing and then dying. Whatever. No, we're just 120 years. That's what our body tells us. cholesterol was getting to the point that it was it would have to be beneficial in the early years to be super high cholesterol and not much reproduced, and then maybe cause a problem down the road. That's what they're arguing. But what's the advantage? So what's the advantage of having super high cholesterol that's damaging you early on? How does that help reproduction? How does that help you having kids and surviving long enough to raise those kids? What kind of sense does that make? People with normal cholesterol are having heart attacks in their 20s now, 20s and 30s, right? So that's not conducive for even having one generation, because if you're in your 20s, you have a couple of small kids and you die of a heart attack. How is that a survival advantage? How is that a benefit to the species? It doesn't make any damn sense. Those kids are going to not make it. So these people are not thinking things through. They hear one thing, generally the vegans say, well, actually it's because you're selecting for reproduction, and like, oh yeah, that sounds good, that'll help me confirm my bias, and I'll just repeat that instead of actually thinking about that. It means absolutely nothing. Yeah, so that's my idea. Your body's trying to do this on purpose. So for me anyway, I let my body do what it's designed to do, and as a result, my cholesterol is a little bit higher than the averages. I'm actually very good with that. I'm okay with that, because statistically that means I'm going to live longer, have lower rates of cancer mortality, lower rates of infectious disease mortality, lower risk of Parkinson's and other neurodevelopmental problems. Your brain's made out of cholesterol. You should think about that while you still have enough cholesterol to do it. Okay. Oh, no, sorry. Here's a question from Fabian, who had the super chat. I'd probably cut off the super chats now at this point, unfortunately, because or maybe give you the 5 minutes to sort of get whatever super chats you want in the next 5 minutes, and then we're going to cut them off because probably have to cap this at some point. We're going on for an hour and a half now, so 5 more minutes, and then we're going to cut super chats. Okay, Fabian says, Carnivore healed my endometriosis and trigger fingers, which is really good. That's really good. Since July, I developed hyperthyroidism, so high thyroid, track 9 TSH 0.1, after reintroducing coffee. Now I'm on a line diet, no coffee. Will it help? Well, it certainly isn't going to hurt. If you're having autoimmune reaction, and that's why you're getting hyperthyroidism, like Graves' disease, these sorts of things, coffee can absolutely trigger that. And so again, these N of 1 trials are really what it's all about. It doesn't matter what results anybody else have. If you do the same results and you get something different, then that's different for you. If everyone's saying, don't do this, my God, don't do that, and you do it and it makes you better, then that's the only thing that matters. So just try it. Now that you've cut that out, and then see how you go, see what your TSH and your numbers show going forward, and hopefully, and most importantly, symptomatically, you may be on medications that are helping to ameliorate the excessive amounts of thyroid hormone that you have, and that's good. And so it may be hard to tell if this is having an immediate result, but given time, if you're feeling really good, and you can see about working with your doctor to sort of lower down those meds and see how that affects your levels and your thyroid expression and your symptoms as well. But yes, anytime you're having these sorts of issues, best thing to do is just get down to basics, and just cut out everything except meat or red meat and water, full line, things like that. Okay. All right, let's see where we at here. There we go. There's a question from Hugo, who asked, first of all, thank you very much for the super chat, Hugo. I really appreciate it. Hugo asked, are you familiar with Anjanus van der Plant's nutrition philosophies? To a degree. I understand that he sort of promoted a carnivore diet. He was more into the raw meat sort of approach. And they had an interesting, I haven't read his full theory on this, it's just been something that's been relayed to me from him, that he thought that parasites were actually health promoting, and they actually came in when things were a disease and helped clean up that disease, which actually strictly goes against all the observed phenomena and experimental data. I mean, we have reproducible data with like malaria, where you take those malaria parasites that are in red blood cells, and they and then or in your blood, and then you transfer those into someone else, give them a transfusion, and they propagate and grow like mad, and they get the disease. And then you cure that parasite, you kill those parasites, they go away, the disease goes away. Malaria kills millions of people a year. So that's not glyphosate. I mean, this is something that's been going on for millennia. You know, and sort of the idea, if you'll get too stuck up in versus train theory, it has to be one or it has to be the other. No, it's both. Obviously, there are bacteria and parasites and other sorts of pathogens that can cause harm. If you're really healthy and you have a robust immune system, then that's going to be much less likely for you to get a pathological disease. But you can still get them. That's why you have an immune system. If you look at these sorts of things, you have people that have cancer, they destroy their immune system. A cold will kill them. You know, they have bubble boys and things like that, that they don't have an immune system. They cannot be around any pathogen whatsoever. So is that terrain theory or germ theory? Well, it's both, isn't it? Because their terrain is unhealthy, but the germ is what killed them, right? If they're completely isolated germs, they're fine, right? A great life, they got to live in a bubble, but they do live, right? So you want to be as healthy as you can be, but pathogens can still harm you. Just because you're eating properly doesn't mean you never get sick. Animals in the wild can get sick. Animals in the wild do get parasites, and they can cause disease and can kill them. If you study parasitology, this is very evident. I mean, it's kind of cool, actually. These parasites, I mean, there's a parasite that infects a specific fish and gets into their brain and makes them sort of tweak and twist in just such a way that they become very attractive to a specific kind of duck. And those ducks swim down, they see that, they're, ooh, I want that. And they get that fish. And then that's what the parasite was actually going for, because the duck is actually their main host. And so now they're able to infect that duck, cause all these problems, spread like crazy, and eventually kill the duck. And then it starts that process over again, getting into fish, going through one part of its life cycle, then getting into a duck, going through the next part of its life cycle, and continuing on from there. So we have direct evidence of this, and so I would not say that parasites are your friends. We have an entire body of our immune system that is specifically there to fight parasites. Now, if you don't get any parasite exposure, this is thought to be something that can cause more allergies and things like that. People have like really horrible allergies. They start exposing themselves to like roundworms or tapeworms, something like that, and it actually improves their allergies, because now their immune system actually has something to focus on and attack and keep your body safe from. And then it's not being overreactive to pollen, which is like shouldn't cause any sort of issue. So, you know, having some exposure, we're meant to have some exposure to parasites, but you can absolutely get serious diseases. I mean, just have a look in the medical literature on this. Of, you know, different people that have had. I mean, you have these X-rays and people's like leg, and there's just these parasite worms all in their muscle, all throughout their legs and their arms and their body. They're just riddled with these things. You're telling me that that's healthy, and they're there to like clean out the badness? Like, no, those things are killing you. And you know, I mean, you only have to take out one set of parasite ova in the brain, seeing intractable seizures and neurological issues. Open the brain, see this big nasty ball of parasites, and take that out of the brain. You have to do that once to realize that parasites are not your friend, and these things are harmful. People die from things like trichinosis. If you're carnivore and you're healthy, you will be much more protected from them. But that doesn't mean that you will never have a problem, and it does not mean that the parasites are good for you and they provide a benefit. That is wrong, and that's demonstrably wrong. I do think that cooking meat, which we've had for like 2 million years, Humans have been cooking meat for 2 million years, and not just humans, but early humans, and people say, that, well, there's no animals that cook meat in the wild. Like, yeah, there are, and they're generally called humans. I'll just bring this up for you, but so here's a list of all the animals that cook meat and have cooked meat in the last 2 years. You have records that these animals have been cooking meat for at least 1.6 million years, and I'll read them. There's Homo habilis, Homo rudolfensis, Homo ergaster, Homo erectus, Homo ancestor, I'm mispronouncing that, Homo heidelbergalis, Homo rhodensis, Homo neanderthalis, Homo denisova, Homo florensis, Homo nensis, Homo naledi, I haven't even heard that one, Homo naledi, and Homo sapiens. All of these animals have been cooking meat for 2 million years. And so, yes, animals actually do cook meat in the wild and in nature. That happens all the time. It's happened for 2 million years. And I think it's probably conferred a survival advantage because it killed the parasites, because other animals get these parasites, bears and things like that. They're getting trichinosis, stuff like that. That actually isn't good for them, that's what a parasite is. It's leeching off the body, and it's causing damage. It's not providing any benefit to that body. And so sometimes you can have a host it won't be as affected by it, but then again, you have different stages of life, and they'll sort of get spread, and it uses that host to spread and then get towards these other things and repeat the process. But it can absolutely cause harm, absolutely cause damage. The idea that we just should never eat anything except raw meat, I mean, that's demonstrably false, because humans have been cooking meat for 2 million years, and our ancestors and our cousins that we're not necessarily even descended from. All of those species that I listed, those are all animals. Those are non-Homo sapien animals that have cooked meat. All of them cooked meat. We have data showing that it cooked completely through the bone, meaning that they were cooking these things well done, and so evenly that they must have had ovens even 800,000 years ago. So we've been cooking meat for a very long time. So whatever happens to cook meat, we're well adapted to it. You do lose some nutrients when you cook meat. Not all of them. Most of them are fine. Some of them you only lose a small portion of, but whatever you lose, we're more than adapted to that, because we've been cooking meat this whole time. And also, there are none of these nutrients that you lose when you cook that are actually essential to human beings. We make taurine, we make glutamine, we make all these other things. And while you lose these enzymes, and some of these people say that at 92 degrees Fahrenheit that these enzymes break down. Like, well, that's funny, because that's below body temperature. So these things wouldn't have even existed in that animal at the time. Certainly when you eat, it gets into your stomach. If the stomach acid doesn't break it down, your body heat will. So, and then it's like, well, you're not going to absorb things as well. Like, according to who, according to what? Because you can say these things all you want, but the evidence is totally against you. All you have to do is just look very clearly, very simply say, okay, well, you're not, if you eat raw meat, then you'll absorb it better. Okay, and what does that mean? You'll defecate less. You won't have less stools, right? That's what that means, because if you're not absorbing it, it has to go out. Okay, so they're saying that raw meat, you'll absorb it more than cooked meat. But if you eat cooked meat, you're absorbing 98%. I mean, there's studies in babies having their first meal that they can absorb up to 98% of cooked meat that they're eating, and so why are we saying that you have a problem absorbing cooked meat when a baby eating their first solid meal can absorb 98% of it? That's what a Salisbury steak was, which was cooked, but you removed all the gristle and just ground the soft meat and added butter to that, and that allowed 100% absorption. It completely rested the bowel, and this was specific for people with Crohn's and ulcerative colitis that had very, very, very bad gut issues, and they had to completely rest the bowel. He said that explicitly, that they need to completely rest the bowel and have no defecation, and that's how you did it. You removed the gristle, Just have the soft meat and the soft fat, and it goes away. Cooked, and people are absorbing 100% of it, and they don't defecate at all. I had a patient who just couldn't eat the gristle, and so she just did that naturally, just cut off the gristly bits and had the soft fat and the soft meat, none of the gristle, none of the connective tissue. And she went to the bathroom once in 4.5 weeks. Right, 4.5 weeks, and it was a very small, soft stool. She's like, I don't feel bloated, I feel fine. It's like, yeah, your body's absorbing all this stuff because you're not eating the gristle. So I don't see any problem. I mean, if there is a difference in absorption, it's minuscule at best. And so, I mean, native populations do cook meat. They do. I mean, you look at the different African tribes. I mean, they're boiling up meat, and they're boiling it well done. They're back in Ethiopia. In Herodotus, thousands of years ago, he said that the only thing we eat is boiled meat and the milk from our cattle, besides water, and our people would live 120 years versus the Persians were only living into their 70s, right? And so that's boiled meat, right? So that's like basically well done stuff. So where is this that it has to be raw? I don't have a problem with people eating raw as long as it's not contaminated. I don't think it's a good idea to get parasites. If you have concentrated stomach acid, we have very low pH, so we can deal with a bacterial load and a parasitic load to an extent. But you don't need to tempt fate. And like, I'm sorry, but the parasites are not benefiting you. Like, there's no evidence of that. There's a lot of evidence that this stuff can harm you very seriously. And what nutrient are we missing if we're cooking meat? What are we missing, right? What do we lose when we cook meat? And what deficiency do we get? I mean, we have pellagra, we got scurvy, we've got beriberi, we've got osteomalacia, we've got these named deficiencies from nutrient deficiencies. And obviously we know about scurvy. That's really only if you're eating more plant proteins and not getting enough meat-based proteins that get the hydrolyzed proline and lysine. Then you need vitamin C to hydrolyze proline and lysine. But if you eat meat, you're just getting that anyway. You skip that step, so you actually don't get scurvy. But in other people who don't eat enough meat, then they could get that. So you have these known deficiencies with names. And what are they? What do we get? What are we missing when we cook meat that we don't get from that we're not getting that we need? What is the deficiency, and how is this seen? We're not having people get sick. It's not like Pottinger's cats where they were eating cooked meat and then they're getting smaller and smaller, and their brains are getting smaller, and their zygomatic arch is getting less developed, and their body size is getting smaller, and their bone density is getting smaller and smaller and weaker to the point that they have, after 2 generations, they have the bones that are like foam rubber that had 3% bone mineralization from 14%. So how that's not happening in people. I mean, and this has been done. People have only cooked meat for generations, thousands of years now, and we don't see any of these deficiencies like you'd see in Pottinger's cats, because cats actually do have these essential nutrients that do cook out things like taurine. They have to have these things, and then there's others, but there are things that they miss, and some of the things with Pottinger's cats are looking at, like cooked condensed milk, pasteurized condensed milk, and things like that. And that was really not healthy for them. Like, yeah, well, no kidding. But we're not cats, and we have been cooking meat for 2 million years. Cats have not. So we're well adapted to whatever happens when we cook meat. Probably does confer a survival advantage because it kills parasites. And I'm sorry, but parasites are not your friend. And then it's sort of funny because they're getting like the vegan sort of mainstream condemnation of meat. Is, oh, you don't want to cook meat because you get all these carcinogens in them. Well, you cook anything and it gets those bird products, they'll get those same so-called carcinogens as well. Where does that data come from? These people are now trying to attack with, first of all, we're all on the same side. And you're saying that we're all saying we should just eat meat and do carnivore. We're all on the same side. There shouldn't be any conflicts there. You want to eat just raw meat? Go ahead. I couldn't care less. I think it's very healthy for you. Just don't do it. Just don't eat contaminated meat. It's pretty simple. But why do you have a problem with other people cooking meat? Like, I sear the outside of my meat. I like the inside rare or raw because it tastes better to me. Other people don't. And I don't see any nutritional deficiencies or any negative health outcomes in thousands of patients who have almost exclusively eaten cooked meat. So, I just don't see these issues. People are having babies that are extremely healthy and growing up bigger and stronger than their parents because they're getting better nutrition than their parents had. So we're all on the same side. There's no point in having strange animosity, but for some reason, there's almost this cult-like following with some of these people that just push the the sort of the raw sort of way of eating and say, no animal. You're not doing a carnivore diet because no carnivores cook their meat. Yeah, sorry. There's about 20 species of animal that cook meat going back 2 million years. So yes, animals do cook meat sometimes. They're called humans, and have been for millions of years. And then they're trying to say, well, you get these carcinogens and all that sort of stuff. I mean, that's just the same. That's one of the tired lies that people tried to scare people off from eating meat in the first place. That they would say that, well, that's not true because of X, Y, and Z. Now they're trying to use those same arguments against people on their same side. The studies that looked at the buildup products of cooking something and burning it, especially, those were done on mice, which have not been cooking meat for 2 million years. So this is not translatable to humans who have been cooking meat and been exposed to meat over an open fire for 2 million years. So you're gonna get those burned products. You absolutely will. And so this is done in mice. It's not translatable to humans. And they were given thousands of times the amount of these chemicals that you would ever find in a very burnt piece of meat, thousands of times. So it's a nonsense. You give something 50,000 times the amount that they would ever be exposed to, and they say, oh, look, there's a 14% increased relative risk association. This is a carcinogen, cut it out immediately. It's not practical, and it's not logical that that's actually something that is going to that should change your lifestyle or recommendations. So I haven't read all of Angenis's stuff. I don't agree that you have to do just raw meat. I don't think it's a problem if you do, as long as you're not getting exposed to parasites and being careful about contamination, because food poisoning is a thing. People have gotten sick. We do have a very strong stomach acid, and if you're not drinking water within 2 hours of eating your meal, you'll have very concentrated stomach acid, and it'll be much easier to break down that bacterial load and not get food poisoning. But that risk still exists, and you need to use your own judgment as an adult to do what's right for you. And same with parasites. Do not expose yourself to parasites. These things are not your friend. You don't want them. We have better capabilities of dealing with parasites than we do than other people eating other ways do. But that doesn't mean that they are completely benign. It certainly doesn't mean they're beneficial. People in Africa eating, hunter-gatherer sort of lifestyles get malaria and die from it. If infectious disease didn't exist, what happened with the Black Death? It took out 1/3 of the population of planet Earth. Was that glyphosate? Was that DuPont came out with Teflon and that just killed everybody? Or, oh yeah, right, it was the bubonic plague. So this is a bacteria, right? 95% of the population of North America died from infectious disease brought over by the Europeans, and they have pictures and drawings of these people, the big boils and pox all over their face. 95 million people died out. And that was the only reason that America even exists today, because that was the only reason we could expand westward, because there's just too many people there. Like, okay, we're just going to stay in our little pocket here, and that's all there's going to be. We're going to try to coexist with everybody. But now they all died out, and they're like, what the hell? Where did everybody go? And they started exploring to see where the hell all the people went. And I just found just open tracts of land and deserted cities and things like that. Actual cities with they could fit 1 million people in what is now St. Louis, full-time residents, 1 million people. That's the size of ancient Rome, right? And at its height, right? So, that was infectious disease. Then there were people that explored in South America, and they went through the Amazon. They found these massive kingdoms and empires and temples and pyramids and all these people, and they traded with them and all sort of stuff in the 1500s. They came back, told everybody about it, and like, wow, that's really cool. We'll set that up sometime. 50 years later, people went back to try to set up some, trade with these people. Nothing. It was just jungle, just wilderness. No one had lived there ever. This guy was like, oh, he must have been full of it. They just told these tall tales. Now they found that actually all of those civilizations did exist. There were massive cities and temples and pyramids and all these sorts of things, but they had just been wiped out by disease, probably from that first ship that came through, and they all died out and knocked them back into the pre-Stone Age, and they were just now just in the jungle hunting and things like that, and very, very primitive sort of way of living. Just knocked them out of technology. They couldn't even understand how to maintain the structures and the civilization that they lived in and been a part in, let alone build on that. And so all these things have been grown over completely. The Amazon jungle is man-made. That was them cultivating those specific trees in certain ways that actually benefited them for the time. It's pretty crazy what they were doing back then. They all died from infectious disease brought from the Europeans. Europeans going to Africa. The average life expectancy of a European on continent in Africa was about 11 months because of all the infectious diseases that they just didn't have protections against. So, so why are we pretending that infectious disease doesn't exist? Of course it does. That's why we have antibiotics. That's why antibiotics work. You have an infection, you see it, you can culture it, you can look at it under a microscope, you can see the damage and harm it's causing. You put somebody on antibiotics, those bacteria go away, the problem goes away, right? If you've obviously never see someone, suffer and die from sepsis and septicemia, or be going towards death and then have antibiotics pull them back into life, or had sucked down an abscess out of someone's brain and looked at it under a microscope and seeing exactly what kind of damage this is doing, just ravaging the brain. So I've heard of them, but I certainly don't agree with all the conclusions he came to. And a lot of these things that he came to, from what I understand, are basically based on, he just sort of had a thought and an idea, but these are completely untested and untried sort of theories. Whereas, these other things actually have a lot of data behind them. It's not to say that everything in Western medicine is true, because we see these things all the time, that probably about half of the things that we take as fact in the world right now to do with human physiology and health is complete and utter garbage, and that causes all sorts of problems. And that's why we're trying to undo all these sorts of things. But I don't think that he got everything right, unfortunately. I certainly don't think you have to eat raw. In fact, I know you don't. If you want to, go for it. Just beware of parasites and bacteria. That's all I got to say on that. Okay, so Oakley's man, thank you so much for the super chat. I really appreciate it. He says, hi, Dr. Chaffee, 37, 5'8", 175-pound male. Have had limb girdle muscular dystrophy type 2 for 7 years, been carnivore for 4 weeks. Have you heard anyone else with this doing carnivore? Any advice or any series or suggestions on advice? No, it's not something that I deal with directly. I mean, there are people with muscular dystrophy who have done keto. I don't know about full carnivore. There's different types of muscular dystrophy. Could some of them be nutritional? I do wonder about that, because cows, for instance, get muscular dystrophy, and they figured out that is a nutritional deficiency. It's called nutritional muscular dystrophy in cows. That comes from a selenium deficiency. You don't get enough selenium in these cows. They don't get, and they can't. Their muscles don't work properly, and they develop muscular dystrophy. So could this be something related to nutrition? It could. I mean, we don't know that, but it certainly could be. And so I would just try it. I would go, very strict, high fat, good quality meats. Try to have some liver, few ounces of liver 3 days a week just to fill up the gaps in these nutrients. And sometimes the soil is a bit deficient as well. So, add in a bit of iodine and possibly even selenium. You don't want too much selenium because that can be harmful if you get too much of it. So you check your levels. You want to be on the high end of their reference range. And you want the red blood cell levels, the RBC, selenium levels. That's more accurate. The serum levels are not very accurate. And you want to be on the high end of their normal range, if not slightly above. And but don't get too far above, because again, that can start to cause harm. So once you get up to the high end of the range, or even slightly above, then you can stop supplementing and try to maintain optimal levels with your diet and see how that helps. Hopefully it does help. Sometimes there's thing called, there's such a thing as damage done, and maybe just during development you didn't have what you need, and that sort of developed your body into what it is now. And you may have persistent problems, but it could be that it can help. I mean, a year ago, no one thought that multiple sclerosis was possible to reverse, and yet I've seen, and now we're getting ready to publish a case series on 12 people who have reversed MS, and not only symptomatically, but their lesions have shrank on MRI. For many of them, we're still waiting on further follow-up MRIs for some of them. So it's definitely worth a shot. It's going to help you in so many other ways as well, that your life is just going to be better. Your life is just going to be a lot better with muscular. Even if your muscular dystrophy doesn't change, your life is going to be better with muscular dystrophy, because you've gone carnivore, and it's going to improve your health in so many other ways. And so definitely worth doing. And please let us know and report back, and let us know how you go with this in the coming months, because that's good information to have. You could also go in to, and the more strict you are, just red meat and water, the better. That's always going to be the best. And if you go into some of the Facebook groups like Zeroing In on Health or Zero Carb Health, they have really good search engines. People have been there for decades, and so almost every question that anybody could ever think of has already been asked. As you go in there and ask for muscular dystrophy, just put in muscular dystrophy and see if anyone else has had has gone on carnivore in those groups with muscular dystrophy. I bet you they have. And see what their results were, see what sort of, see what their experiences were as well. Again, there's different kinds of muscular dystrophy, so maybe they have a different kind that would respond differently to you, but it could still be interesting as well. And either way, you just try it and you see what happens, and hopefully it does help, and good luck with that. Okay, so Yvonne Gosler, thank you so much for the super chat. I'm a 47-year-old female, 5'8", 90 kgs, 2 months carnivore, 80-20. I'm assuming that's calories from fat versus protein. 1,800 to 2,000 calories per day. Weight loss is 6 kilos in 2 months. The issue is I just missed a period for the first time ever. Has been perfect until now. Any ideas why? Well, no, I don't necessarily know why. Could you be pregnant? That's a very common way to miss periods, and so obviously that's an important one to know about. The other thing is that you just make sure you're eating enough and eating properly, and eating the right proportion. So it's less important about the proportion of the fat to protein that you're getting, and just making sure you're getting enough lean meat, you're getting enough fat. So you get enough fat, enough protein, and enough of those nutrients that come along with them. So you want to eat fat until you get soft stools, but not loose stools. And you want to eat enough lean meat that your body is satisfied, that you're maintaining lean, healthy body mass, and that you're not hungry and that it doesn't taste good anymore. So you eat fatty meat until it stops tasting good. If you want more and more and more, and your body's telling you more and more, you keep eating. And make sure you're getting enough fat that you're having soft stools. So if you're eating until it stops tasting good, but you're having hard stools, it might be that you're eating too lean of meat, and that's why it stopped tasting good. And so you need more of that fat added in. So adding things like butter or trimmings, things like that. Hard to say otherwise. You can certainly get things checked out. I mean, it's one missed period. So a pregnancy test, first protocol, and see if it comes later on down the track. You've been 2 months carnivore. There is often a disruption in hormones, especially for women during that time. And sometimes you can get a disruption of your periods, because that's sort of just a reflection of your hormonal balance. And for most people, this will balance out after about 4 or 5 months. And so, just keep doing all those things that I mentioned. Make sure you're eating properly and all the rest, getting proper rest and sleep, not over exercising, etc. And at that point, and just give your body time to heal and recover. So when your hormones get a bit out of balance, that can disrupt your period. They usually normalize back and can be very consistent and normal after that. And again, usually after about 4 or 5 months for most women, that improves. And so to the point that now you have just normal periods after that. And a lot of people don't even experience period pain after that, which is great, as long as they're very, very strict. And so that could be exactly what that is. There's generally a disruption. Some people, that disrupts their period, but not everybody. Pregnancy test, obviously, and then just give it a bit of time and just make sure you're doing everything else right, and see how you go. Okay, so this is from Oakley's man, who has said correction, a different type of muscular dystrophy type 2A, can only eat 1.5 pounds of meat so far. That's okay. Just eat fatty meat until it stops tasting good, making sure you're getting enough fat. Sometimes if you're eating more lean, it just stops tasting interesting or earlier. And but if you're having soft stools, not loose stools, then that's okay, as long as you're not having coffee, tea, artificial sweeteners, magnesium, metformin, other medications that can cause loose accelerated motility. So a lot of people keep drinking coffee, unfortunately, and that hides the fact that they're eating far too little fat. So just keep that in mind as well. If you need to eat more than once a day, fine, do that. Just listen to your body, eat as much fatty meat as your body's telling you to, and eat as many times during the day as your body wants you to, and you should be fine, and see how you go. And if you're losing more lean mass than you think you should, just try to sneak in extra meals here and there. Okay. Next question is from Umar. Thank you so much for the super chat. I'm not going to butcher your last name. I'm not even gonna. I don't think I would get that right, and so I don't want to insult you. But thank you very much, Umar, for the super chat. I really appreciate it. Umar says that he's a 25-year-old male, 6'5", 225 pounds. Good for you. That's good. Well done. I have psoriasis and arthritis, and recently diagnosed with vasculitis. 20 days carnivore, bad diarrhea. Got prescribed prednisone, but not taking it. Doing 50,000 IUs of vitamin D. Can I work out? Yeah, you can. If you're having issues with the arthritis and pain and things like that, obviously ease into it. The diarrhea can be from just sort of adapting to this way of eating, your microbiome sort of changing around. That's pretty common. But it can also very much be the fact that now you're not eating fiber, which slows down the motility of the gut. That's what shows in randomized controlled trials. And if you're still having coffee, tea, artificial sweeteners, usually in the coffee or tea, magnesium supplements, and other medications that can cause loose stools, that could be triggering this off. And now, even though they didn't do this before, you were eating differently before. And so, especially when you cut out fiber, for instance, fiber slows things down. And so those other things like the coffee or whatever can act as a bit of a mild laxative. That can actually help. That can actually help speed things along so things are a bit more normal. Now you take away that roadblock, and all of a sudden, it's coming out way too fast. So if you're having any of those things, just cut them out and just go to just beef, lamb, and water, because you have psoriasis, and it sounds possibly like psoriatic arthritis, which is not fun. There's a friend of mine, Phil Escott, and we had an interview with him, and I had a few interviews with him, but he had psoriatic arthritis as well. I mean, he was really, really sick with that, and he reversed this with carnivore. And then he sort of said, okay, well, I'm doing so well. I've been doing so well for like 12 years. Maybe I can have a couple of drinks here and there. Well, it seems to be okay. Well, maybe I can have a little bit more, and maybe this, and all of a sudden, boom, had this massive flare up. Really, really number on him. He was very sick, lost a lot of weight unintentionally. He was already very slender, and and very unwell. And so then he had to go back really strict, just beef, lamb, and water, and that, and sort of let his body heal over time, and then he's back to normal, which is good. Any autoimmune issue like psoriasis or psoriatic arthritis will always do best on red meat and water, just pure beef and water, beef, lamb, and water. There are a lot of reasons for that, and I have videos on that about rethinking autoimmune disease and the real cause of autoimmune disease. So I talk about these sorts of things and what that is. The diarrhea, again, cut out everything that could be causing an issue, and then sort of modulate your fat, because if you're having a lot more fat than your body can absorb, you'll get loose stools. Or if you're having a lot less fat than your body needs, you'll fast hard stools to watery diarrhea. Sort of a U-shaped curve. You have to sort of sit right in that middle of the correct amount of fat, and then you should be fine. And if it is just your microbiome normalizing, that'll happen, and it'll sort of take care of itself. Again, coffee, tea, sweeteners, any sweeteners, and even magnesium, especially things like magnesium oxide. I mean, that's just basically a laxative. If you take magnesium, it should be magnesium glyphosate, especially if you're having problems with loose stools, because that has like 85% absorption, whereas the other ones are much less than that. You can definitely still work out, but obviously, you just need to be careful with your condition, and don't hurt yourself, and let your body heal a bit. But but stimulating your body with exercise is really healthy too. 50,000 IUs of vitamin D3. Just remember, you want to take that with a comparable amount of vitamin K2. So if those are combination pills, D3 with K2, great. If it's not, you want about generally 100 micrograms of K2 per 10,000 IUs of D3. So for 50,000, that would be about 500 micrograms, things like that. And good luck with it. I'm very excited for you. You've been going on this for about 20 days, which is great. You start seeing better and better results as you go from here on out. This is when you start getting that sweet spot where things all start to improve. The more strict you are with just beef, lamb, and water, the better your psoriasis and arthritis will be. And tallow moisturizer, don't use any other sort of chemicals or treatments on your skin. You can trigger psoriasis just by the things you put on your skin, not just what you put in your body. So things like tallow moisturizer are really good for that too. Okay, thank you so much. We'll go on to the next one here. All right, JV Free, thank you so much for the super chat. Dr. Chaffee, your carnivore diet work is amazing. Your podcasts and talks make the science clear and help so many reverse chronic issues with meat. Thanks for inspiring us, and God bless. Well, thank you so much. I really appreciate that. I'm glad it's helpful. I hope it remains helpful to people. I hope people do benefit from that. I mean, I know that they do, which is why I keep doing this, because I've just seen so many thousands of people, hundreds of thousands of people at this point improve so dramatically. And we're sort of hitting that critical mass where now people are having to talk about it on the news, and even just to trash it, but at least they have to talk about it, because enough people are doing this and improving that they have to try to scare them away from other people doing it, even though there's like people reversing MS and other sorts of major diseases that are crippling, debilitating, or even life-threatening. So it's just amazing to see everybody getting so much better. It's just wonderful, and I'm glad that I could be a part of that, and I'm very, very, very humbled and blessed to be able to help. So I'm very glad that my video's been helpful, and thank you guys for watching. I really appreciate it. From Timothy Tilsley, thank you very much for the super chat. Looks like it wasn't a question attached, but it looks like there's one down here. So thank you for the other super chat. Thank you so much. Timothy says, getting a biopsy on a possible basal cell or squamous carcinoma. 3 months into carnivore, feel great. Blood work looks great. Is there anything I can do? Well, I mean, just keep doing what you're doing. Just be as healthy as you possibly can. Being ketogenic is really important, because that starves out the potential cancer cells. And then just getting the biopsy and getting that removed if you need to is very important as well. I mean, these are things that take decades to build up in our body, and so this is something that's been brewing for a while. If it is something like a SCC or BCC, but that's okay. Everyone starts at the point that they start, and we just go forward from here. So treat this as your doctors recommend. I don't I think that's the right thing to do, and then also be eating this ketogenic carnivore diet, which will help not only reduce your risk of future cancer, or it should anyway, but could help, can help with any sort of active cancer, because it starves out the cancer cells from getting enough glucose, which is their main fuel source. They require 400 times the amount of glucose as other cells. They have multiple times more insulin receptors on the surface. So when you raise your insulin, it just power drives glucose into those cancer cells exponentially more than into your normal cells. So that's really important to keep your damn insulin down and your blood sugar down as well. So those are all important things. But no, I think you're doing great. Definitely do follow up on that biopsy and get those little suckers removed if you need to. I mean, there's they're pretty common, but I think that they're common because people are eating trash and putting toxic things on their skin and in their bodies, and eating a whole bunch of plants that have phenocoumarins that make you photosensitive, make you burn and get more damage than the sun. The sun is an important nutrient. It's very helpful and it's very beneficial to our health. But if we're damaging ourselves from the inside, causing more inflammation, causing more photosensitivity, it can then cause problems. It can then cause damage. So that's not good. You can still overdo it on a carnivore diet, but it is so much more difficult. I mean, I've spent weeks in the Australian sun during summer, 110, 120 degree weather, never had a shirt on the whole time, 16 hours a day in the sun every day, and didn't burn. Got a bit of flaking on my nose, bit of flaking on my shoulder. That was it. And I was just really overdoing it. No sunscreen, anything like that, just tallow or emu oil. And felt great. Got a really crazy tan. I got red, but then it turned into a tan. It didn't peel. Right. Whereas normally when I was a kid, out in California, I go out, I get red, and I'd just be peeling for days. It was horrible. Right. But that's because we're eating differently. I'm eating differently now than I did as a kid. Even though I ate a lot of meat, I was literally forced bodily to eat vegetables, these other things, which then cause you to be more photosensitive. And so you're going to get more damage that way. You can still damage yourself on carnivore. It's just much less degree. And so you still have to use your own judgment, your proper judgment, but it's so much different than if you were, it's like if you were taking medication like doxycycline that makes you photosensitive, makes you burn more, can give you more skin damage. Plants do that too. And so you're not eating these things, you're making more vitamin D properly, which helps protect you from the sun as well. It's just much more difficult to damage your skin. You can still do it, but it's much more difficult. I mean, I have patients that are actual redheads with freckles and things like that, like orange-haired redheads that now tan. They don't freckle anymore; they tan. And so, that's pretty interesting how the body works so differently in so many different ways. So good luck with that. Hopefully, that turns out to be nothing. If it does, I'm sure your doctors will take good care of you. Okay. Oakley's man, thank you again for the super chat. I really appreciate it. No anime. Have you heard anyone doing carnivore with muscular dystrophy? I've heard you talk about cows having. Okay, so this is sort of carry on from the other question. Yeah, I apologize. I do get to all the super chats as soon as I can. Sometimes they sort of down a ways, and it takes me a while to get to them. But I do always see the super chats. Because I have them starred and sort of sent to the side. So yeah, hopefully I was able to answer your question on that. Okay, so last question is from Matt Hutton. Thank you so much, Matt, for the super chat. I really appreciate it. Matt says that his wife keto from February 2020 from 24, carnivore now for 12 months. Great, that's really cool. Lost 32 kg since keto, including 14 kg since carnivore, but stalled since July. Well, first of all, that's fantastic and really well done to her and to both of you. That's a really big accomplishment. I mean, 30, 32 kilos. So, for other people, that's, I mean, you're talking like 60 pounds, 70 pounds of weight loss, really 70, maybe even 75 pounds of weight loss. That's massive. That's a huge, huge accomplishment. And just, a year and a half. I mean, that's amazing. So a lot of people struggle for a lifetime to lose that much weight. And she did it in a year and a half, which is fantastic. So first of all, very well done. So stalled since July. Insulin is 4 months after going on 4 months after going keto, dropped to 9, but since has been sticky and high at 10. Any ideas why the weight has stalled? Well, there can be a lot of reasons. So it's sort of difficult to sort of run through all of them, but there can be hormonal issues. If she has an underlying thyroid issue, which is quite common, that could be an issue. Like if she has Hashimoto's, I mean, she could still be triggering her Hashimoto's if she's not eating just strict bland diet, just beef, lamb, and water, because it's an autoimmune issue, and all autoimmune issues do best with just beef, lamb, and water. So that could be slowing down her thyroid, which would be slowing down her metabolism. Insulin of 10 is actually really good. 9 or below is what's optimal for the typical standard population. Again, not a ketogenic population. She would sort of expect that sort of be below 6 or 7 long term, but different things can affect this as well, such as stress being a major one. Stress will raise blood sugar, will raise insulin, and will derange your hormones, will stall weight loss. Absolutely. Dairy is a major one. It's sort of a sneaky one. It will have carbs, even yogurt and kefir. They have carbs in them. Sometimes they'll have as much as half the carbs as milk does. And people don't realize that. They think, oh yeah, there's no carbs in there because the bacteria eat it. They eat some of them, but they don't necessarily eat all of them. And so you have to look at the packet and the label and see how many carbs are in there. So that's and dairy is a classic weight loss stall. Even if it's not, even if you're not getting the carbs, you can get the casomorphines, which will trigger overeating and will also trigger fat deposition, because it's trying to tell that baby animal to store energy, grow big, eat more, so that it grows, because babies are vulnerable, and so they have to eat more. And so if you if she's having any sort of dairy product, I mean, even butter, I would just cut it out. I would just eat whole meats with fat. I would just go straight down to line diet. I would, in fact, eat more fat as opposed to less fat, because a lot of people find that as they increase the fat, especially in a proportion to their protein intake, that can actually trigger weight loss and get them through stalls. And so that's something to think about as well. When you really get down, really get your protein level down, you get down to about 9% calories from protein, 90%, 91% calories from fat, you find that you trigger something called FGF21, which triggers lipolysis and increases fat loss by 400 kilocalories per day. So that's a lot. And you're in ketosis, and so that's further going to stimulate 350 kilocalories of fat loss a day, because that increases your basal metabolic rate by 350 kilocalories. So now you're getting 750 extra calories burned just from your metabolism, your metabolic state, and your hormonal state. So that's really good. So more fat is generally better when you're trying to get through a fat stall. Cutting out all dairy is really important. Making sure you're sleeping properly, and because the insulin is sort of hovering around 10, even ketogenic carnivore, I'm sort of suspicious. Are there carbs coming in from some dairy or from something else, or is there high stress, poor sleep? If you average 5 hours of sleep a night or less for just 7 nights, you can actually give yourself pre-diabetes from that cortisol spike, and so your blood sugar's up, your insulin's up, and that will definitely stall your fat loss and weight loss. If you and also, how are you taking the test? Are you taking it first thing in the morning? Are you fasted? How long have you fasted? Did you get a good night's sleep the night before? If you have a bad night's sleep and you test your blood sugar and your insulin, they will be elevated. So you need to check things when everything's very neutral and calm. You haven't exercised or stressed out or even had sex for a couple of days before. You've gotten proper sleep for a few nights leading up to it. then you check, and that's much more accurate, especially for hormones and things like insulin. So those can be some reasons why. Also, is it weight that she's trying to lose, or is it fat that she's trying to lose? What's her body composition? How are her clothes fitting? Is she exercising? Is she working out? Is she lifting weights? If she is, then she's putting on muscle. She will be putting on muscle, and she's losing fat and gaining muscle at the same time. That can offset on the scale. So the scale is not the end-all be-all. It's a poor surrogate for body composition, which is really what we're looking for. We're looking for changes in our body composition. We're trying to get leaner and more muscular, or at least leaner. And so the weight on the scale doesn't necessarily tell you that. So you have to look at body composition. How are her clothes fitting? Does she need a belt? Is that latching up, or things are close fitting more loosely? Did you get a DEXA scan? Did you look at the before and after on her body composition, things like that? And if she's not working out, try working out. Try doing high intensity workouts. Try doing sprinting. Try doing circuit training with weightlifting, giving only 30 seconds rest in between sets, the minimum amount of rest that she needs to then do the next one, because that triggers hormones and lipolysis, that triggers fat release, that increases her metabolic demand and her metabolic rate, and she will start to lose fat as well. It will increase growth hormone. Growth hormone stimulates fat loss, and so that can also help slim down as well. Proper sleep as well, because you maximally secrete growth hormone 2 hours after you go to sleep, if you go to sleep on time according to your circadian rhythm. That's another thing. She's sitting indoors all day with artificial lights on all the time. Does she get outside? Does she get natural light? She's getting out in the morning, so her brain is, being the normal circadian sort of triggers and things like that. As a follow-up, whereas she's saying she's losing fat, she's definitely much more healthy overall. She's doing strength work and exercise, and over 12 to 18 months, she's lost time, but the measurement changes have stalled too. So yeah, so all those other things are in play as well, right? So all those other things are important to look at also. So it's not just necessarily that. So doing the workouts, but doing it high intensity, very low time in between sets. Circuit training, so you're doing from one exercise to the next one, to the next one, to the next one, back to the first one, or 1, 2, 3, back to the first one, things like that. And you're doing sort of a circuit. It's harder to do in a gym because people take your equipment, which is really annoying, but do the best you can. And so that sort of high-paced tempo exertion is going to trigger growth hormone as well, and that will help. That will help fat loss also. So those are all a lot of different reasons why she could be stalling on her fat loss, and some things to try too. And good luck with it. I hope she does well. She's already doing fantastically well. Hopefully she continues to keep getting the results that she wants, and good luck with that. Okay, so we just had a new member that joined the YouTube membership, Kenny Demeter. Thank you so much for joining the YouTube membership group. If other people want to join, we have another community in YouTube. We'll get more sort of YouTube only videos, sort of more behind the scenes, different sorts of thoughts that I have that I sort of come up with, and make videos on to discuss with. We're also doing YouTube lives just with members, and so those would be exclusively just for members. So it's a sort of a tighter knit group. Be able to get more questions asked and answered and things like that, and things like that. So we also get early releases to the videos for most of the videos as well. We're still keeping the some things like the premieres. For some reason, they won't let you do a premiere if you've released something to members, unfortunately. So we still have those new episodes coming as premieres for everybody. We'll have other videos coming just early for members that we're not releasing as a premiere, and then members only videos and polls and community chats and things like that, and lives, like I said. So if that sounds appealing, you can join down below. And either way, thank you all so much for coming on. It's been an absolute pleasure. We went for about over 2 hours, which is probably pretty good, but probably run out of time now, and so have to run. And see you guys next time. I will be traveling in the next couple of weeks. I'll try to see if I can do a live next week at a similar time, but we'll just have to see, because I might have to change the time around, or do it on a different day or something like that, just because I'll be traveling around for work and then seeing family and things like that. So we'll see how we go, and we'll get something up anyway. And either way, thank you all so much for joining. It's always great. We're going to keep doing these regularly each week, schedule permitting. And so we'll see you all next time. Thank you all for joining, and thanks to everyone for submitting questions, and especially for the super chats. It's very appreciative. Obviously, I try to answer questions as much as I can, but I obviously need to prioritize the super chats, so I go to those first, and if I can, I do the other ones as well. So thank you all very much, and we'll see you next time.